So I'm trying to address lung cancers, right? Then trying to talk about, a very common scenario where lung cancers always metastasize to the brain. It's a particular artery known as the middle cerebellum. Okay, the cerebral artery, cerebral, not cerebellum. Okay. So from the lungs, it spreads to the brain, all right, particularly to this artery. All right, so let's talk about the connection. Okay, so lung cancers, especially adenocarcinomas and the small cell lung carcinomas, they are one of the most common types of cancers that will actually spread to the brain tissue. So these brain metastases often localize in specific vascular territories, including middle cerebral artery. All right, we're not saying it's only the middle cerebral artery, but the middle cerebral artery is, all right, the common place where you have these issues at. So why this middle cerebral artery? The middle cerebral artery supplies a large portion of cerebral cortex, including your motor areas and your sensory areas. So studies show that the lung adenocarcinoma metastasis preferentially involves the distal middle cerebral artery territory. So particularly the precentral and the postcentral gyri, which are critical for your motor functions and also your sensory functions. So these spatial barriers may be due to vascular flow patterns and the microenvironment of those regions. Okay, so you can see it. So pathological features: metastatic lesions appear as well demarcated masses, often surrounded by edema. Histologically, they retain features of primary lung tumors. So hemorrhage is common in brain metastases from lung cancer. Do you understand? Like the middle cerebral artery will usually burst off, all right, bleed inside the brain, okay, when this cancer spread to that place, all right. So such patients are now, you see reasons why they might be showing up some neurological symptoms, right? So clinical implications, it depends on the location though, but common issues like hemiparesis and hemiplegia, sensory deficits, all right, seizures, cognitive issues, and your ability to actually produce speech is also being disturbed. Okay, so diagnosis and management is MRI with contrast, whole brain radiation therapies, okay, then targeted therapies or immunotherapies, and surgical resection, all right, which is kind of like the definitive care, right? You cut out the tumor. Alright, then you can also use, we've spoken about those immunotherapies where you strengthen the immune system to fight the cancer cells more.